How do surprising factors affect non-melanoma skin cancer? How do surprising factors affect non-melanoma skin cancer? Non-melanoma skin cancer, which includes basal cell carcinoma and squamous cell carcinoma, is often linked to well-known causes like ultraviolet radiation. However, there are several surprising factors that can also influence its risk. First, let's talk about ultraviolet radiation. This is the leading cause of non-melanoma skin cancer. Ultraviolet B rays primarily damage the outer layers of skin, leading to sunburn and DNA damage. Ultraviolet A rays penetrate deeper, contributing to skin aging and increasing cancer risk. The more cumulative sun exposure you have, especially severe sunburns in childhood, the higher your risk becomes. Next, skin type plays a significant role. Individuals with lighter skin, red or blonde hair, and light-colored eyes are at a greater risk. This is because melanin, the pigment in skin, offers some protection against UV radiation. Those with darker skin have a lower risk but are not completely immune to skin cancer. Age and gender are also important factors. As we age, the risk of developing non-melanoma skin cancer increases due to the cumulative effects of UV damage over time. Interestingly, men tend to have a higher risk than women, likely due to greater sun exposure from outdoor activities or occupations. Another surprising factor is immune system status. If your immune system is weakened, whether from medications after an organ transplant or certain diseases, your risk for non-melanoma skin cancer significantly increases. A healthy immune system helps repair DNA damage and eliminate cancerous cells. Exposure to radiation from previous treatments can also raise your risk. If you have had radiation therapy for conditions like acne or cancer, the treated areas may be more susceptible to developing skin cancer. Additionally, environmental radiation, such as nuclear fallout, can contribute to this risk. Chemical exposure is another surprising factor. Certain chemicals, like arsenic found in some pesticides and contaminated water, can increase the likelihood of non-melanoma skin cancer. Occupational exposure in industries like mining or pesticide application is particularly concerning. Genetic factors can also play a role. Rare inherited conditions, such as xeroderma pigmentosum, increase susceptibility to skin cancer. A family history of non-melanoma skin cancer can indicate a genetic predisposition, elevating your risk. There are also less common factors to consider. Chronic skin inflammation or injury can promote the development of non-melanoma skin cancer. Additionally, infections with human papillomavirus have been linked to some squamous cell carcinomas. Smoking is another risk factor, especially for squamous cell carcinoma. To maintain healthy skin and reduce the risk of non-melanoma skin cancer, it is essential to minimize UV exposure. This can be done by avoiding the sun during peak hours, wearing protective clothing, and using broad-spectrum sunscreen. Regularly monitoring your skin for changes is also crucial. Being aware of occupational and environmental exposures to harmful chemicals and radiation can further help in prevention. In conclusion, while ultraviolet exposure and skin type are significant factors, surprising contributors like immune suppression, chemical exposure, previous radiation, genetic conditions, and chronic skin damage also play a vital role in the risk of non-melanoma skin cancer. Understanding these factors can help in developing effective prevention and early detection strategies for maintaining healthy skin.